if you're working with human services and you strongly disagree with the way the agent handled the complaint or the way they're handling the child, you know, I'd set, once the complaint was over, I'd sit down with that caseworker, agent, whatever you want to call them, and ask them why and what and why did they make that decision, and explain your side and try to work together. You know, if you lose your relationship with Health and Human Services, you're at a big loss in this county. We depend on that agency a lot. You know, working here in school or working in mine on calling them out all hours of the day, night, weekends, holidays. They come in and help. They do what they can. You know, they're not law enforcement officers themselves. Sometimes they got a different view or a different avenue or route they'd like to take that they think would better help that child. They got a different program they're going to put them in. You just got to keep an open communication with Health and Human Services and work it out. Explain your reasoning, have them explain theirs, and come up with some sort of compromise so it will work.
Basically, the real issue here is whether or not this child falls under the Chapter 51 statute. The fact is, we don't know everything that Human Services is doing with this family, with this child, and they're not going to share that information with me. In law enforcement, we don't have the right to know everything that's happening in that family. Unless the child is a direct threat to himself or others, I will not second guess a Human Services employee. I have had instances where we definitely have to talk about this, but the real reason, I believe, is that we need to do what's best for that child. They're the ones that they're trying to deal with that child. They are dealing with that family. They know the background of the family, mothers, fathers, sisters, and all the other brothers, and they might have some issues going on. I don't need to know that, and they're not going to tell me that. I will respect the Human Services worker based on the fact that as long as the child is not a direct threat to himself or another, which would fall under the Chapter 51, I will make a note of it, and we will sit and have a talk about it tomorrow, but as of today, we'll go along with what they say.
I guess there's different rules that, guidelines that social service has versus law enforcement. I guess the ultimate goal, we want to do what's best for the child. It isn't always the best circumstances or the best way to deal with it, but we do what we have at our hands at the time. But I think it's something that should be addressed and looked in more closely. How can we work with law enforcement and social services? My whole thing as sheriff, well, not the whole thing, but a big part of being sheriff, I want to be more involved with the kids, and I want those kids to know that we're not the bad guys, that they don't need to be afraid of us. And maybe if we could work with social services in those programs and get these kids to trust us and you know, be up with them, and don't give them a reason not to trust us. And we can always improve, and the way you improve is by talking to other agencies, find out how they do things. By trial and error, you learn, but then you have to put those things into effect when you learn them, and you have to be willing to go out there and learn those new techniques and then implement them.
I'm not sure of the question, other than there's different parameters for juveniles. If we're talking a crime or we're talking a chapter, or Chapter 51, folks, is basically a mental health commitment. Putting a child in a mental health commitment because the cop said so. That's where we used to be able to do it. Can't do that anymore. Governor's last biennial budget says we must involve child protective service, mental health crisis intervention counselors. That's that end of it. And you get the crime end. So let's take the broad spectrum and talk about if I was involved with a juvenile and the caseworker from Human Services and I may disagree on something. We all think we're legends in our own mind, old Clint Eastwood says, you know, and that might be true. But we also have a willingness to understand that we may not be experts in that field. I'm not an expert in juveniles. Is anybody an expert in juveniles? I mean, you have kids. We've developed a good relationship with our Human Services Department for the last 19 years. It took a long time to get us to where we are today. And that's not just the sheriff's office. That's the Spooner PD, the Birchwood, the Minot, the Shell Lake PD. We had some difficulty when we first came in. We worked through those issues. We're at the level now that if one of my officers has a disagreement with a caseworker about whatever the case may be, if it's a crisis intervention or if it's a child protective services or whatever, and it comes to my attention, I go right to the top, generally, of that director. I either go to the Director of Human Services or the Director of Health Services or Director of Child Protective Services. One of those three people, and I can say, we may have a problem. We have to be willing to keep that good relationship, and let's improve on it if we can. I think there's always room for improvement, but we have a great relationship. We're not always going to agree. I don't agree with the chiefs, all four chiefs either sometimes, and I know they don't agree with me a lot of times, but you sit down and you work it out. I have no difficulty sitting down with people and say, all right, we got this problem, so let's work together. How are we going to resolve it? And sometimes I have to take a step back and say, you know what? We can live with that. And then we need to move on.